So the discussion that I want to do today is about the reactive oxygen species as the basis of a major cases of inflammation, especially chronic inflammation. So the reason for us to kind of understand this is that we can look at the inflammatory pathways, we can look at how these pathways can be modulated, but under their hood, under that hood, the thing that is driving the inflammation, uh, barring any chemical factors, any light factors, any mechanical damages or injuries or infections, the food and lifestyle related chronic inflammation. Under the hood is reactive oxygen species, which give rise to misfolded protein aggregates, which then cause cellular functional disruption, which then result in inflammation. And all of these inflammatory pathways can then start working and overlapping with each other. So as we modulate the inflammatory pathways, it is also important to understand how to handle reactive oxygen species and the misfolded protein aggregates. So let's look at it quickly. First, the mechanism and then some lifestyle ideas. So first of all, reactive oxygen species can be produced by many reasons. More common reason is a lot of nutrient intake. So for example, glucose or carbohydrates are a big player in producing reactive oxygen species, especially fried foods, for example, that produce advanced glycation end products that contain advanced glycation end products are called age products, which can cause inflammation of the gut. Plus, when they are absorbed in the blood, they can cause inflammation of other tissues as well and produce a lot of reactive oxygen species. Simple glucose utility can actually produce a lot of reactive oxygen species. There are hypotheses and research that even pancreatic beta cell damage is because of glucotoxicity, because it allows the glucose to come in all the time. So what happens is that when we have the nutrients available, glucose, let's use that as our example, the electrons taken, the energy taken from the glucose is loaded on NADH and FADH2. These NAD before the electron is NAD, and then it becomes NADH, and the other one is FADH, and that becomes FADH2 after receiving this energy. The NAD provides, or NADH provides that energy to complex 1 in the electron transport chain. FADH2 provides that energy to this complex number 3 in the electron transport chain. These energies, not molecules, energies, the electron energy packets, are then slowly moved from high valency atoms, shells, valency shells to the lower shells, which then causes that energy to be released. That energy is then used to move hydrogen or protons out. This is not important, this part. Protons go out from the matrix of the mitochondria to the intramembranous space. From there, those hydrogen come back through the ATP synthase, and in that process, ATP is produced. Complex 1 and 3 also leak these reactive oxygen, electrons. Now, mitochondria is rich in oxygen as well. The oxygen that we breathe is delivered to mitochondria. So when these electrons leak out of complex 1 and 3, they attack the nearby molecules, and the most common are oxygens that are present nearby. So oxygen molecules now gain an electron and become superoxides. From there, other reactive species also are formed, like H2O2 or hydrogen peroxide, and then hydroxyl and so on. These species get out into the cytosol, and while in the mitochondria, they would attack the nearby proteins, DNAs, RNAs, lipids. The reactive oxygen species that get out into the cytosol, from that cytosol, they will go into the lipid environment as well. The lipid environment, all the cell membrane is phospholipid. Similarly, the nuclear membrane is phospholipid. The mitochondrial membranes are phospholipid. Golgi apparatus is phospholipid membrane, endoplasmic reticulum. All of the organelle of the cell have phospholipid membranes. So these reactive oxygen species get into the phospholipid membrane as well, and they attack the polyunsaturated fatty acids. So those fatty acids which are unsaturated, they have those double bonds where they can accept more bonds. So these are the weaker areas, and they are the ones which are attacked by the reactive oxygen species. So once a reactive oxygen species attacks a lipid molecule, that species becomes normal because it has given away the extra electron it had, the extra energy it had. But in that process, the lipid now has that extra energy. The lipid, I believe, is called reduction, right? Gain. So lipid is now oxidized. Or is it oxidation or is it reduction? So oil rig, oxidation is loss and the reduction is gain. So lipid now gains electrons, so that is that is the reduction. Interestingly, this oxygen provided its energy, the reactive oxygen provided its energy, and itself the oxygen molecule now became normal. But lipids are not that way. Once you radicalize a lipid, it will then work with more molecules and then attack another lipid and radicalize that lipid. Now, when the other lipid is radicalized, this lipid is still radicalized as well. So this is a start of a chain reaction. Who was the primer? Who started it? Who was the matchstick in this one? The reactive oxygen species. That is needed to start this. But once it is started, now the lipids are falling over like dominoes, and that chain reaction continues. That causes nuclear membrane damage, that causes cell membrane damage, that causes Golgi apparatus damage, that causes endoplasmic reticulum damage, and so on. And we have to get ahead of that very quickly. So very quick lifestyle suggestion: vitamin C and vitamin E, water-soluble antioxidant and lipid-soluble antioxidant. They both should be taken. Vitamin E is lipid-soluble. That would go into the lipid membranes and help reduce or help oxidize these radicals and normalize them. The water-soluble, like vitamin C, will get into the water-soluble environment and take care of reactive oxygen species there. So just taking vitamin C or just taking vitamin E is not sufficient as an antioxidant. You have to have antioxidants for both environments. There are some antioxidants, for example, alpha-linoleic acid, which comes from the omega-3s, that actually is water-soluble and lipid-soluble. It can work in both environments as an antioxidant. Glutathione is antioxidant as well. N-acetylcysteine is a very useful molecule that can convert to glutathione very quickly, so that can be taken as an antioxidant too. CoQ10 is a very good antioxidant, especially for the mitochondrial damage. And then other antioxidants, for example, I forgot others, I'll tell later on. So now that we have the reactive oxygen species and reactive lipid species, that is the radicalization of lipids is called beta peroxidation. Now reactive oxygen species in the cytosol do other type of damages too. The most important damages are to the protein. So cytosol, imagine it's a city, the inside of a cell, where there are so many enzymes and they are working and they're doing their function. Some enzymes are hauling other proteins from point A to point B. Some enzymes are constructing roads, which are the microtubular system of the cell. Some enzymes are actually working with the energy and so on. A lot of work is happening. While this work is happening, here comes a reactive oxygen species, an energy, a fireball, and that strikes a protein. That was a worker. In the proteins, of course, proteins are made up of amino acids. The cysteine and methionine are two weaker or vulnerable amino acids that can get very quickly, once again, reduced, or they can take up that electron, given by the reactive oxygen species. In that process, the cysteine and methionine, they change structure, and that causes the whole protein structure to be changed as well. Imagine there is a building and you fire at the base of the building, the whole building will tilt over, or you fire in the middle and the whole building would become D-shaped. When this happens, very quickly, a set of proteins called heat shock proteins, they will become activated, especially HSP70 and HSP90, and they would try to refold and correct this misfolded protein now, the protein that was attacked. And you can actually imagine if the reactive oxygen species bombardment is too much, like in chronic inflammatory states, then even the heat shock proteins will become attacked. So the recovery units themselves will become damaged too. And this cell is now out of hope. It would just die or become inflamed. But normally heat shock proteins will become activated. They would try to refold the protein. Some of the heat shock proteins would hold the proteins. Others would try to refold them, or they would engulf them inside of them and they will try to fix them. If this fix is successful, then the protein is allowed to get back into the cytosol and go about doing its business. However, if that does not happen, then the heat shock proteins will then trigger the ubiquitination system. And the heat shock proteins themselves can be triggering the ubiquitination system. It is called ubiquitin proteosomic system, or UPS system. Otherwise, they can also mark this protein for destruction. So the recovery crew comes in, the heat shock proteins, they try to fix the protein. They're not able to fix it. They would put a flag on that protein to say this protein now needs to be destroyed. So ubiquitination system will come into play to try to destroy these proteins. And the lysosomal, there are endosomes in the cell which will receive these proteins, and these proteins will then be recycled. So that is a second attempt of the cell to fix them. But imagine that the fireball, rain was happening, and the protein is damaged in so many places, and the protein is all out of shape. This protein, which is out of shape, is not able to be ubiquitinated. It was not able to be healed by heat shock proteins. Now it is not ubiquitinated by the ubiquitin system. So then a third system that usually runs in parallel to ubiquitination system is the autophagy system. Autophagy system will be activated, and autophagy system would try to pick up these bigger, more damaged proteins and those proteins that are aggregated with each other and try to clear them out. But imagine yet the autophagy system is not activated. This severely misfolded protein could not be ubiquitinated. Then the responders, the doctors and the nurses, the clinicians of the cell will just drop that protein and say, we cannot do anything about it. So now imagine a lot of such misfolded proteins are present in the cell. What are they going to do? They're going to start tangling with each other. This is like if you have a lot of pieces of, threads, and you put them all together, they will become tangled, and now they are a mess. This protein tangle or aggregate of misfolded protein, they are actually called misfolded protein aggregates. And some of the diseases caused by them, for example, Alzheimer's and Huntington's and other dementia diseases. This actually happens in the remaining body as well. And in the remaining body, there is chronic inflammation that happens because of them. And then according to the tissue, the disease appears, the liver cirrhosis or the pancreatic damage and the diabetes or the renal damage or the neurological damages or muscle fatigues and joint pains. Depends which tissue is involved and what is the damage and what was the function of that tissue. Now, these aggregates are developing and they are settling in the cell surface. Within the cell. When we are younger, these aggregates are yet fewer. We are eating unhealthy. You can eat unhealthy in the young age and nothing happens. And then you can eat unhealthy later on in advanced age and you pay the price right away. What happens is, in the younger age, our cells were relatively empty. I wish that I had a little box over here in which I put the aggregates and you saw the box filling up slowly. So in the beginning, that cell is less filled. And so the protein aggregates are not causing any more damage. They're just sitting there. There are some stress to the cell, but the cellular functions are going about normally. As we continue to eat, let's say, carbohydrates, fried foods, or have other environmental stresses, the result of that is that these aggregates continue to increase in amount. This is like a pile of trash. Imagine in my room right now, there is a pile of trash that has built up. And my apologies, I kept my window open. So this is the sunlight here, and this is the normal light. So I thought this was okay. So anyways, now that pile of trash has gone up and up. After 30 years, it actually starts it accelerates, because by 30 years of our life, there is active maintenance of our cells. But after 30 years, you have to kind of help these cells maintain and modify your lifestyle, which people like me did not do. And I'm now 50. So that means now I have a lot of misfolded protein aggregates. My cell has reached that threshold where these aggregates, the trash in the cell, is causing mechanical disruption of the cellular function. If I'm an enzyme in the cell and I want to move from here to another point in the room, and the room is filled with that misfolded protein aggregates, it will be difficult for me to move. Microtubular system will become disrupted. The enzymatic system would become disrupted. Even the DNA repair enzymes will be disrupted. DNA continues to become damaged as the cells are duplicated or they are exposed to lights or other stressors. Sometimes DNA develops mutations. Those mutations are repaired by DNA repair enzymes. Generally, they're not able to repair everything, but they do repair. However, when there are misfolded protein aggregates, the repair capacity of these enzymes will become lesser as well because of mechanical disruption. And so now there would be mutations that are being accumulated in the DNA as well. Where did this all start from? From reactive oxygen species causing misfolded protein aggregates, those aggregates causing mechanical disruption of cellular functions. And the more you disrupt a cellular function, the more dysfunctional the cell will become, and further disruption will accelerate. So now, the best bet for this cell is to trigger autophagy and clear out these protein aggregates. The problem is that most of our lifestyle is such that autophagy is not triggered easily. So why is it not triggered easily? Because we have ample amounts of nutrients coming into our body all the time. The autophagy usually gets triggered when we are in a fasting state. So we eat our breakfast, and then we eat snacks, and then we eat lunch, and then another snack, and then dinner, and a snack before going to bed, and maybe something in the middle of the night. That environment, cellular environment, where there is just continuous bombardment of nutrients from outside, tells the cell that you do not need to do autophagy, because the function of autophagy is to pick up trash from inside when the cell feels that I'm not getting any help from outside, and pick up that trash and recycle it. So autophagy is not triggered. Aggregates are present. Now what happens? One, there is a mechanical disruption of cellular function. Secondly, there are epigenetic changes in the DNA that would start accelerating in their accumulation because there is cell repair loss for DNA repair. Thirdly, the cells have sensors for stresses inside. Like there are NLRP sensors, there are NRF sensors. So there are sensors within the cell to observe the internal state of the cell. So when those sensors are now blaring, because the aggregates are supposed to be a stressor. So when the cell stress observers will observe the piles of trash, they would send a signal to the nucleus saying, we have a stress signal from the cytoplasm. What will the nucleus do? it will start producing inflammatory state. It would try to do autophagy. And the second thing is it would start producing defensive mechanisms. And those are, for example, interleukin 6, tumor necrosis factor alpha. And it is now, I shared this study a few months ago, tumor necrosis factor alpha can actually go to brain and activate the glial cells of the brain. It can go from the body to the brain. And this tumor necrosis factor alpha is produced by the chronic inflammatory state where we have eaten and caused the cells to become filled. And secondly, infections or other reasons for inflammation can also cause the tumor necrosis factor alpha to be produced. That can go to the brain, and the patients of Alzheimer's and dementia, they can actually have an acceleration of dementia because of tumor necrosis factor alpha coming in and activating glial cells of the brain, which causes inflammation of the brain and further accelerating dementia. So imagine now somebody who has dementia and also has chronic inflammation because of the food style that they had, and their cells are filled with trash, misfolded protein aggregates, and these cells are now continuously producing tumor necrosis factor alpha. They cannot stop it now. It's being produced from every cell, and it is continuously going to go to the brain and cause acceleration of dementia. I would suspect, I don't have a study, but I would suspect that it would actually trigger dementia as well, but I do not have a study to back this statement. So now the cell is in inflamed state. What will the cell do next? Cell would try to do autophagy, but even the autophagic systems may not be able to come in existence and work because the cell is so mechanically disrupted because of the trash all over the place. If that happens, then the cell would decide that I am going to just die. I have too much internal stress signal coming, too many stress signals coming in. I'm not able to handle those. I'm not able to correct the situation. I should do apoptosis and die. If the cell is not able to do apoptosis, then you could say, why not? Because of the misfolded protein aggregates that are disrupting even the apoptotic machinery. Then the cell can actually become senescent. That is, it would stop dividing anymore. If it was a dividing cell, it would just sit down and remain metabolically active and keep producing inflammatory molecules and just sit there and be upset. Senescent cells can now make other cells senescent. They didn't die and now they're grumpy and they're trying to kill others. They could not cure themselves, then they became grumpy and now they're trying to cause inflammation. And then the third possibility is that as the cell is producing inflammatory molecules, plus because of the misfolded protein aggregates, the cell is not able to perform its functions correctly. The cellular surface proteins are not made correctly as well, which will cause the immune cells to become activated, and they would try to kill the cell by phagocytosis or cytotoxic T cells or natural killer cells that would just release granzymes and perforins. Perforins would come and make holes in the cell, and granzymes are the proteins that would get into the cell and try to once again kickstart the ubiquitination processes and kill it. Even if the cell cannot start the ubiquitination process, then just perforins punching holes in the cell would bring the cellular integrity of the internal environment disrupted, and now things from outside are going in and things from inside are going out. In this whole process, even mitochondria gets damaged. And the more damage to the mitochondria, more reactive oxygen species, more protein aggregates, more inflammatory state. Then the inflammatory pathways, all of those pathways that you will read in the book that we are writing. But under the hood, the fire is coming from reactive oxygen species, reactive lipid species, protein misfolds. So what can we do about this? What is the rehabilitation that we can do? What help can we give? Now, if our youngsters understand it, they should have a more healthier diet. They would have more omega-3 in their diet. They would have less carbohydrates in their diet. They would have correct calories that they need. They would not have stressors of diet type, too much fried food, too much processed food, too much colored food, too much preserved foods. They will not have those. And they would, believe me, not become diabetic even 70, 80, 90 years later, or not have chronic inflammations and joint pains and muscle fatigues, even that type, or not have wrinkles and those things that are appearing on my face now, because their cells would stay younger. Those who are in my age, for example, and have not had the knowledge of all of this, including me, what will happen for them? So first of all, try to trigger autophagy. To trigger the autophagy, what is necessary is to make a cell hungry. Intermittent fasting is very important. And how do you do intermittent fasting? You don't just say, all right, from today, I'm fasting all the day today. There are some people who can do it. For example, some religions ask for the fasting, so they are used to doing it. But intermittent fasting can be started with, if you have 3 meals and 2 snacks or 3 snacks, you can remove the snacks, number one. Number two, you can remove the smoothies and juices, because smoothies and juices crush the fruit or vegetable cells and bring out all of their internal components, which are easy for the digestive system to absorb. If you have eaten a whole fruit, that would have its fiber and other molecules that are tangled with fructoses and glucoses, and so it would be difficult for our digestive system to break them and absorb them, so they would be absorbed less. Their glycemic index will be low. But if you already crush them and give it to yourself, you have a very high glycemic index. So juices and smoothies, stop them. Then remove your snacks in the first couple of weeks. Then maybe clean out your breakfast and not have any carbs in there, no toast in there, just maybe eggs or some other healthy meat or something, plants, whatever you fancy or you like, but try to reduce the carbohydrates. There are folks who are plant-based who say that don't reduce carbohydrates, but try to reduce fats. Either way, whatever will help your inflammation, and you will see that as your body would start responding and you would have lesser symptoms of inflammation. Clean out the breakfast. Then clean out or reduce carbs in the later meals. Then pull the dinner earlier, push the lunch later. Then merge these two, or start skipping the breakfast. Then go to Dr. Jason Fung's method, where he asked the people 3 cases where there were 3 individuals who were insulin dependent for 20 years, for 10 years, diabetic, type 2 diabetes mellitus. And he asked them that one day they will only have dinner with less carbohydrates. The next day they'll only have lunch and dinner. That was their intermittent fasting. And within 3 weeks, there was no insulin requirement anymore. They didn't need the hypertension medicines anymore, and they became healthier, normal. So intermittent fasting is the keystone activity to perform, at least to empty out some of that trash that is present there. So imagine if the threshold is 50% of the cell filled with the misfolded protein aggregates, that is when the inflammatory state occurs. Then maybe as we do intermittent fasting, we remove that trash and bring it down to 30% or 25%. And now you once again have some margin where you can actually eat bad once more and be okay. But the thing is, you would quickly get back to the inflamed state if you have only emptied that for aggregates to a smaller amount. Then what else do we do? If the mitochondrial dysfunction is happening and mitochondria are producing reactive oxygen species, then the near infrared light really helps. Near infrared light falls on the mitochondrial complex electron transport chain complex number 4 and helps it become kick-started again. Electron transport chain complex number 4 can actually pick up the energy from the light, just like plants can pick up energy from the light as well. It is a cytochrome molecule. It is a chlorophyll-like molecule like plants have. And it can take the energy from the light, and then it can use that with the ATP synthase, and it can start helping make the ATP again by pumping hydrogen ions out, and those would come back with the ATP synthase, and then the ATP will be formed. Once the electron transport chains are kick-started, then the remaining electron transport chain would start working okay as well, and the mitochondria would start becoming healthy. How do you do that? Near infrared light. Do you want to get it for free? Did you see that intermittent fasting is free? It actually saves you money. You are not eating much, so you're not cooking and buying as many groceries. For the near infrared light, morning light when the sun is rising, and evening light when the sun is setting, the sun is falling on you through an angle, and that angle causes the sunlight to pass through a very bigger amount of atmosphere or the this environment, and that causes many of the light rays to be filtered out, and near infrared is present, and that near infrared can actually penetrate 4 inches into your body, including your clothing. So you could be all bundled up in the morning and in the cold environment and go out for a morning walk or evening walk and have near infrared light. 10-15 minutes is very good. Then forest bathing. Go near the plants. Go to the parks. The essential oils from the forests, they actually reduce the stress hormones like steroids, and which would then cause the corticosteroids, which would then cause reduced norepinephrine, which would then cause immune system activation in a correct way. Natural killer cells work more, and the whole immune system becomes balanced again. Then mild exercise. Rigorous exercises, if you are not preparing for training for something, these exercises can put more mechanical stress. If you're already inflamed, that can cause even more inflammation. So mild exercise, which would put some stress on the cell, but not so disruptive stress that the cell would die or become damaged, that would also start autophagy. Plus, the exercise would pick up glucoses from outside as well, because exercise causes the microtubular movement inside the cell, which causes the nucleus to put the glucose transporters to the surface in the absence of insulin. And if you're diabetic, you would tremendously benefit from that. Then take vitamin C and vitamin E, or water-soluble antioxidants and oil-soluble, fat-soluble antioxidants. These are a must. Then if you could not, let's say, do autophagy, you could not fast for some reason, then you can have fasting mimicking foods. These are the foods that do not have a lot of calories, but they make you filled and you feel like you have eaten, but you are still fasting. So you can have fasting mimicking foods, or you can take supplements like resveratrol that can trigger autophagy. So as you modulate your inflammatory pathways, it is important to make sure that you have a lifestyle, no smoking, no alcohol, lesser stress, psychological stress, less glucoses, less fried foods, proper antioxidants, proper anti-inflammatory supplements. You would see that your cells would start becoming empty. And once they're empty, they would be as healthy as younger people's cells. And I say that with confidence. Here is why. I'll give you, this is the last point and then we stop. A young person's cell and an older person's cells are actually not much different in their age. Here is why. And this is all, you can read that, you can see it on the Google. Our cells produce new cell membrane pieces all the time. Phospholipids are manufactured in peroxisomes all the time. Or endoplasmic reticulum, I'm saying peroxisome. In endoplasmic reticulum, smooth endoplasmic reticulum all the time. Where do these phospholipids go? They go and they replace the older molecules in the cell membrane, and they replenish and refresh the cell membrane. They replenish and refresh the nuclear membrane, mitochondrial membrane, Golgi apparatus membranes. So your cell's membranes are as young as a young person's membrane. The young person's membrane was built today, and yours is built today as well. Enzymes. Do you know that our enzymes do not live with us from our baby's time to now? Our enzymes are created, they perform their function, and then they are torn down. They are recycled. This happens 8-10 hours. Every 8-10 hours, we make an enzyme that does its function, then we remove it. Some enzymes live for 2-3 days. Some enzymes live for a week or so, but they are torn down. So the enzymes that you have in your cells today are probably a week old. So your cellular enzymes are new. Your Golgi apparatuses are new. Your ribosomes are new because they're formed just now. So why is it that advanced age, for example, me, I have a lesser healthy body compared to a younger person? The only main difference is the protein aggregate and the epigenetic changes that are accumulated in the nucleus. We start producing health and young age by removing the aggregates, which then allows the repair enzymes to work correctly, and hopefully they can go about fixing the epigenetic changes as well and bring us back towards health. I do not know how long we will live, how long will I live or you live, but I know that we can live in a healthy state. And that this is the crux of that. This is the fountain of youth that I just discussed with you. With this, thank you very much, and I will talk to you later.